Yes, I was going to ask the same question. It's going to be pretty distracting to presenters to hear people entering the waiting room. I don't know how to turn off that feature in Zoom, but presumably some technical person there might be able to assist. Good morning. Thank you for your introduction and also for my elevation to a very wealthy fashion designer, Kenneth Cole. But I am Kenneth Connell. I don't mind being Kenneth Cole. I wear his fashion as well. But it's great to be on the panel this morning.
Recording in progress.
So thank you, Fabian, and good morning again to the audience and my co-panelists. So quite often when it comes to matters concerning health, even as a health practitioner, I like to step back and put things in perspective because I recognize that although I wear a biased hat, which will always be health first, I need to step back and kind of see how do these things kind of how are they supported in the general landscape that all of us have to live and work in. So I came up with three questions which I think are important for all of us to consider, whether we are in manufacturing, whether we're in health, or whether we are consumers, and all of us are consumers. The first question is, do we have a right for health? Do we have that right? Is that a human right that all of us share, right? That's the first question. I'm sure that my co-panelists and the audience would agree. We have a right to health. We have a right to education, all the other rights as under the UN, but we have a right to health. The second question is, if we agree on the first, do we have a right to know fully about the factors affecting our health? Now, this is where I have to wear my medical hat, and I'll use an analogy. If someone comes into my office, is it sufficient for me to say, take this medication or do this without fully explaining the impact of whatever they're consuming is going to have on them? Does the patient have a right then? Do they have a full right in as much as possible to have what we call informed consent? So do you have a right to that, to know everything about the factors affecting health? Would we be doing young people a disservice, for instance, if we did not tell them that cigarette smoking increased their risk of various cardiovascular events and cancers? Do they have a right to that information? And the last point is, do we have a right for choice? We've just come out of a pandemic. Many things have been said about the vaccine and taking or not taking, but do we have a right to choice? And I think we have decided in the region, we all have a right for choice, right? It is an informed consent, but we only have true choice if we understand the full implications of what we are choosing. You can't say choose product A over product B. If you're really not sure what's in product A or product B, you are likely to make the incorrect decision. And my final question, so I want to drill down on these questions. The first question is, do we have a right to health? And do we have a right to fully be aware of all the factors affecting health? And the third question, do we have a right of choice? The fourth question is, are the above rights currently met? And that's a simple question. If we agree to the first three rights, are the above rights currently met? So in other words, are we currently enjoying a right to health? Are we currently enjoying an atmosphere where we know about most of the factors or as many of the factors that we currently know in our society affecting health? And the final point, are we being allowed to choose with informed consent those factors which we want to avoid? And really, this is what front of package warning labels come down to. And interestingly, last week, I listened to Minister Cummings make a statement about consumers having the right to know where hidden costs are. You shouldn't be able to go to, for instance, I think the example used was to purchase something and be told you get 50% off the second item, but then only on higher purchase, and then the higher purchase price is a lot higher. So you're really not getting 50% off the item at all. But does the consumer know that if the message is so mangled and has to be in a small print or magnified so that it's clear to them? And therefore, if they don't, are they really making a choice, or is the choice really being made for them? So the fight against NCDs, and I agree with our co-panelists, it can't be just front of package warning labels. Let's use education as an example. We can't say that to improve education, we should only reduce class sizes. We know that might be a factor, but certainly other factors, pedagogical design, training of teachers, change in instructional design, all those things will impact education outcome. However, this does not mean that you don't try to reduce class size. or you don't say, well, I think that teacher qualifications need to be improved. So all the factors that affect education need to be addressed, and I'm sure are being addressed in education reform. The same is true for health. Health is no different. We know that we live in a health landscape, all of us, and that doesn't just include a hospital. And therefore, the environment that we live in needs to be as conducive to healthy practices as possible, including choice, which I mentioned earlier. So front of package warning labels allow us to have a choice. And it's interesting because as a university officer, we often get accused of, where's the research kind of thing? Are you just is this just a hunch? Well, we know from the March study in 2021 by the University of Technology that the octagonal warning label was shown to be the most effective front of package warning label to influencing consumer choice. Again, I'm going back to choice. All right. It was 2.1, 2 times higher in terms of choosing the nutrients with octagonal versus other methods of labeling. So we do have data. The data is out there. Sometime during the program, you might probably allow me to share my screen. So maybe I'll share the study, because it's important that people understand that this is not just a hunch coming from a health community, but there has to be some kind of factual backing of it. We also have data published this year from the Pan American Health Organization in September, actually, Pan American Health Organization and UWI. And this statement is a powerful paper, and I want to repeat that. This statement is a powerful paper, and even in its very highlighted introduction, it states warning labels have the potential. Now, this is where my colleague said, all we can say is potential because they haven't been implemented in the space. But it says on the paper, it has the potential to avert 16% of deaths by NCDs and save the country, that is Barbados, $732.8 million US dollars just by implementing front of package warning labels. And various models are used, as we use for, say, predicting. I hate to make references to the pandemic so often, but as the same modeling that we use, it's the same type of modeling used in statistical analysis for predicting how these labels will change choice and how the change of choice will influence selection. So let me close my opening shots there by saying that all of us, regardless of which sector we are representing, need to agree first on those 3 questions. If we have a right to health, do we have a right to fully know the factors affecting our health? And thirdly, do we have a right to choice using informed consent? And I'll close there. Thank you. Mhm. 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 All right, so thank you very much. I'm not sure I have tentacles in the ministry, but I will respond. So I guess what a lot of Barbadians may not know, and this is entirely, and I'm gonna take the blame here, possibly the fault of the commission, is that there is a national NCD commission within the Ministry of Health and Wellness. Commission is an all of society, as was mentioned, approach with representations from industry, from academia, agriculture, health, of course, all with one purpose: to create a healthier landscape with respect to the NCDs. And of course, the front of package warning labels has occupied the attention and discussion of the commission, as well as the associated marketing and education that will need to occur with any product, including front of package warning labels. But I should have also mentioned that the media is also and broadcasting is also represented on the NCD commission. So in direct response to your question, the answer is yes. And of course, in anticipation of front of package warning labels, these discussions have intensified. But let us first of all not divorce FO PWL with education, because front of package warning labels are part of education. Education involves full disclosure of information, and that's what the front of package warning label allows for, full disclosure. So yes, consumers need to understand what the actual labels mean. They just can't appear on products or not. They will just see these stickers and think, well, what are these for, kind of thing, and ignore them. Interestingly, no one ever picks up an item without looking, at least most of us, I'm probably guilty of it, without looking at the cost of it. So we are the behavior is already there to look at the cost. Some of us, such as myself, might even try to determine, well, how much is this? Am I really paying on VAT, the total value compared to what I'm paying on VAT? And sometimes this is very clear. Sometimes it just says, X percentage VAT, and then you kind of have to work out in your mind or even receive that percentage VAT at the counter. So again, information can be packaged in different ways and it will affect behavior. I've just used a cost example. Now, front of package warning labels are merely meant to allow for easy visualization to the educated public on making a healthy choice. So yes, I agree with both my panelists strongly on this. This can't just be seen as a cure for all. It also cannot be seen as we have to get everything in place and working before we make any steps towards changing the health environment, because panelists will agree this is not make sense either. We have to, some things will need to be done sequentially, some things they will need to be overlapped. And the other point I want to strongly agree on, this is nothing without monitoring and evaluation. And this is for any sector. Health, yes, you're implementing a front of package warning label. You want to see how much has this changed behavior, one. But remember, this isn't just about changing behavior. Does this actually have an impact on NCDs, which is the whole end product or end outcome of this front of package warning label? Now, interestingly, there was a study done this month, as I said, with PAHO, WHO, and the University of the West Indies, looking at the impact on choices for the macronutrients, as well as the impact this would likely have on NCDs. And I would encourage everyone in the audience to Google that paper, PAHO, WHO, from the package warning label, to put it in, and it will come up, the September publication. Now, my colleague mentioned that, how do we really know which front of package warning label is right for us here in Barbados, which is true. We haven't had a national study done. The closest neighbor that we've had is, of course, Jamaica, looking at the impact of other labels on influencing choice. We could argue that our population is vastly different from Jamaica and we're going to perform completely different from them, but that is again unlikely. And again, that did show that the octagonal front of package warning labels was superior in choosing making the healthier choice when compared with other mechanisms. So I know quite well, having lived in the UK, the stoplight system. Again, I would have thought that it might have performed better either as well, but I can't go against what has been already published, and hopefully we can get some local data here as well. So the points I'm trying to make is response to your question, yes, the NCD Commission will address education as part of the package. We address other things, not just education, front of package warning labels, access to healthcare, access to cheaper and healthier foods, right? So this is where the cost factor comes in. All those things are covered in the commission. The second thing is, it appears that based on the data that we are seeing thus far, there is a difference in superiority in terms of which label makes a difference. But I agree, if we want to make the argument, we need to see local data because Barbadian population is completely different from anywhere else in the world, then I agree that that also should be studied. But we have data from Jamaica showing that there's a clear difference in making choices. And this month, we have data looking at the impact on not only choices, but modeling looking at on NCDs. But as you said, we can only correctly or we can only accurately identify the true impact it has on NCDs once it's been implemented. But this doesn't prevent us from predicting the likely impact it will have based on models, data modeling. Hmm. I hope. Okay, you go ahead, please. I was hoping you wouldn't. I don't. So those are not addressed on the on front of package warning labels, but if you are really curious about that, then it's reading information about the product that you're purchasing and being satisfied, best of your knowledge, that these things that you've just identified are not part of the processing or packaging of the product. But that's not part of front of package warning labels. Look at macronutrients, so sugars, fats, and also micronutrients such as sodium trans fats. Those kind of things are part of the packaging for front of package warning labels. But what you're speaking to is more about product ingredients and formulations or even processing. I guess that's where BNSI might come in. I'm not sure if you go into that granularity though in looking at organisms used in processing. And you're muted on our end. So Fabian, now I'm actually curious. So where would I find that information? Should I contact BNSI if it's not clearly stated anywhere, or I can't find it anywhere for that product? Are you the agency I should contact? Great. Thank you. Yeah. Maureen, I was similarly confused, so I'm agreeing with you. But I'm glad for the clarification. Mhm. Excellent. And this is a recorded presentation. Maureen, I'm not sure if you were finished. I just wanted to add though, when we speak about cost, we often think about the cost of the intervention, which is applying the front of package warning label, but the cost in the totality is how much is the country saving at the other end in terms of the NCDs and the cost of NCDs. So there will be an interesting study by a health economist, not myself, to look at the total cost and not just the cost for the intervention. Mm. Or we have a hand up.
Good morning. My
Good
name
morning.
is Janice Oliver Chris, President of the St. Vincent and the Grenadines Diabetes and Hypertension Association. representing civil society. Listening to the addresses made, must say it is a very fruitful at this point in time. All of the comments made, much valuable. Even Dr. Connell and the others who made their comments. But what I really want to say at this point in time, we are not saying that the front of package warning label can, curb NCDs, but what we all need to really put into perspective is looking into the future. When we look at our young people as early as 15 years of age, and we are seeing that they are coming down with diabetes, even kidney problems. I mean, we are saying that, yes, it may need, other things added to our front of package labeling, but it is looking at it, it stands out to you. For me, going to the supermarket or wherever I may bought a product, and I will be able to say, high in sodium, that is telling me something. We look at the younger person who may not able to really could figure out what it is saying, but the fact that it's saying high, it is sending a message. Yes, we all may agree that it needs some other things added to it, but we are looking, at the future of our generation to come. And we have to protect them because they will become the future workforces. And if we don't have people to work for us, then we will not own, and then our products will not be even able to come off of the supermarket. So we have to look at it at a broader perspective. Look at into the future, what could happen to us, as all of us as consumers, than just looking at it now. Yes, we know it will incur costs, but we can weigh it. We can weigh the costs and weigh the consequences down the road. So yes, it is a fruitful discussion where much can still go into it, and it can benefit all of us across the Caribbean and into the wider diaspora. And thanks to all the panelists, which are able to explain and give us a lot of information. Thank you.
Yeah. Education. Mm-hmm. Yeah.
Yes, good morning. It's not really a question, but just a comment. I would like to state that as a member of the BMA Bico Limited, we would have met recently, and our recommendations, I think, on the BMA position, I don't see a representative there today, but position on the currently proposed octagonal Chilean model standard, we didn't support it. And our issue was mainly, I think one of the panelists raises the doctor at the beginning raised that several issues there. The information provided is lacking in that model. You just say high in sodium, high in fat, high in sugars, but you can't stay, you don't see what, how much percentage and how many grams. So we think it didn't provide consumers with sufficient information to make that choice, and also discrimination among products. Because if everything, let's say, or based on our information, 70%, 80% of the products, processed products on the market is high in something. It leaves the consumer without any choice. But if you have additional information, how many grams, how many percentage, what level of these nutrients of concern on that labeling, it allows consumer that choice. So we didn't think it provided consumers with sufficient information. The currently proposed octagonal labeling system, FOPL, doesn't provide that, the Chilean model. And like I stated earlier, we support for the front of package labeling, but the currently proposed model did not support that. So the Manufacturing Association did not vote in favor of that model, I can say that. And I hope that the Barbados delegation didn't on a whole, because the currently proposed Chilean model, I don't think bodes well for manufacturers nor consumers, right? In addition to that, I've studied the regulations along with that standard that was developed by CrossQ, and it skews the calculation in which they used to determine whether something is high is skewed. If I do an analysis using, let's say, the traffic light system, manufacturers have already begun, like the private sector representative said, to introduce products that are healthier. But we find that when we run the model, our analysis, product profile analysis, through the traffic light system, we can move from, let's say, high to even amber or even green by making changes. There's no sugar added ingredients, there's low fat added ingredients we can make substitution for. But with the calculation and the method of the regulations used to calculate whether something is high using the Chilean model, the products were always high. And I mean, I'm a scientist, I know numbers, because based on their calculation, their reference is not fixed. The Chilean model, it compares the amount of, let's say, I think is calorific content of fats and sugars to the total calorific value of the product. But if you reduce your sugars or fats, which is a major contributor of calories in a product, the total amount will reduce. If you reduce it in the numerator and the denominator, the impact would be negligible. So you can find yourself as manufacturers making innovation to create more healthier product with less sugar and less fat. However, the currently proposed Chilean model, because of how it works, it doesn't reflect that change commensurably in your efforts. So it leaves us manufacturer without no incentive to innovate, no incentive to introduce healthier products, because everything you efforts make is basically going to still result in a high level at the end of the day. Is less, it has a lower impact. And again, consumer doesn't have much choice then. If the manufacturers are unable to innovate and introduce healthier products, then again it affects the consumers again. So we currently couldn't support the system that was proposed. The Chilean model is octagonal system and the supporting regulations, and we encourage others within the manufacturing sector and the private sector to reject it. That is my comment.
Choice. I was going to emphasize the question, do we have a right to choice? Which is what you're saying.
The right to choice is impacted because
Mhm.
you basically have in the current system, I think based on the research that we've done, almost all processed products will be labeled as high. So what choice does that leave the consumer? And also manufacturers like ourselves who has been innovating and have no sugar options, low fat products and all of these things. Based on the current model, when we run it through the two different systems, the Chilean model always had it high. In the traffic light system, you can move from high to medium and from medium to low, and the consumer has the ability to see the changes in the number of grams and the number of percentage of these nutrients of concern, percentage, right? So it leaves us as the manufacturer no incentive to innovate and introduce products that are healthier, or we have reduced these nutrients of concern, because it won't result in a change in this either high in this categorization they use in the current regulations. If you look at the regulations, don't focus on the labels. The labels are not a problem for us. Is how do you classify something as being high? The mathematics behind it, the science behind it, how you evaluate it.
Right. Okay. So if I'm hearing you correctly, Mr. Hines, your two issues are the determination of the front of package warning labels, one, based on the calculations of how they were calculated, and secondly, the fact that they don't provide consumers with enough information, really, because all you're saying is high salt, high sugar, high whatever. But the counter argument to the second point is also there. I mean, do we really expect that the 7-year-old is going to go into the supermarket looking at percentages of carbohydrates versus protein versus all the other subnutrients, or even the other extreme? So we're guilty of this in medicine as well, making things highly technical and then saying, "Oh, we gave the patient all the information," but when really and truly, if they really can make an informed decision because they really could not understand. So the point about the front of package warning labels is so that a clear label, or as clear as possible, a label is given to the consumer so that they can make a quick decision. There's no need to be a scientist like yourself or myself to understand it. There's no real even need to read the details because it's out there to the front of the product. Uh, to your question about the calculation, now I see that there is a nutritionist online here who may want to respond to that. How they actually calculate. Now that's another debate. But I just want to respond to the clarity of the information on the package. I don't think we should make it more complex. I think we should make it as clear as possible to the consumer.
Yes, and we believe that is so. But my I'm talking about not just bike manufacturers, and I speak I speak as a consumer too. You know, if I go into the supermarket and all of the products in the aisle has high in sugar, high in sodium, what choice does that leave me without the additional information? I now need to be able to look at several products and say, well, look, all of these are high, but look, this one has a lower percentage in it. The octagonal system does not provide that. Allow you as a consumer to discriminate. Let's say all of the drinks in the supermarkets are high in sugar. We know they will be high in sugar. But the natural juices that I can pick up from one of the manufacturers may have a lower sugar content, right? because it's the I tell you, look at the regulations. It's looking at the total sugar content, not just added sugars. So a mango drink has natural sugars in it. Mango fruit has natural sugars in it, right? And all of these things. So when they look, it is no way for me to distinguish between all of these high products that are high in sugar that, well, look, I will choose this one which is lower at least, or at the lower end. It has a lower amount of percentage sugar, or it has a lower percentage of something, one of these nutrients of concern. And for me, that reduces customer choice, consumer choice, right? So I'm not just speaking here as a manufacturer. I shop for my kids and my family in the supermarket as well.
Yeah. Mhm.
Good afternoon. Sorry, it's still good morning. I am here in the capacity of being the chairperson of the Barbados Childhood Obesity Prevention Coalition. My name is Anne St. John. Um, okay, I was listening to the robust discussion, and it seemed to me, I did hear Mr. Hines' input as well, the concern about the fact that we're missing the point. Some people do miss the point, that the front of package warning label is a warning label. It is there to help to educate shoppers, consumers. They're usually the adults, not the children. And in reality, over the years, the amount of nutritional information on the backpack labels has become so microscopic, difficult to read, time consuming, and worse still, in a different language. Although I know the regulations in Barbados are not um, accepting that. You often go into the shopping centers, supermarket, food stores, and you see labels that are in a different language. So back to the point where the front of package warning label gives you consumer empowerment to make a decision. Naturally, as he said, things like ice cream will be high in sugar, high in salt, a little bit, but there are standards. And as other presenters have stated, education remains one of the basic tools that we have to continue to educate people on how much sugar is acceptable level, like maybe 15 grams, for example, instead of 28 grams that you would see on some of the juices and drinks and consumables. So that's just my brief input as to more support for front of package warning labels.
I also want to add to what Prof has just stated that I was going to say that remember that these 7-year-olds as we educate the public, including in the school environment, hopefully they too will be able to identify front of package warning labels and which products put them at risk. So it's not just one extreme will be eliminated. I hope in the future that school children will be able to go even without their parents and say, well, look, this has 3 or 4 octagonal warnings on it. I'm not going to choose this product over the other, but that will come with education in our schools.
Good morning, everyone. It's not really a question. Yeah, it's a comment. My name is Keisha Wayne. I'm a food and nutrition teacher at one of the secondary schools in Barbados. And I'm also a member of the Caribbean Association of Home Economists. And my assertion already to me is that what I believe is missing, or a crucial part is missing, is the linkage to the Caribbean territories or eating guidelines and the daily food guide for the Caribbean. Now, when we check the labels, we see the nutritional facts is in grams or milligrams, but how does the average consumer exactly know what that means? What would we say would be a measurement that the average household uses? They use maybe tablespoons and teaspoons. So what I find for me is more relevant and maybe to be used along with obviously the frontal warning labeling package is to show how much tablespoons is in a particular product. So when we see those infographics and you see how many tablespoons is equivalent to 1 gram, I think that seeks to give the consumer more information. So what I would like to see for moving forward is for us to use this labeling in conjunction with our daily food guides for good health. That is pivotal to me and pivotal for consumers understanding exactly what the labeling means. So when we look at our Barbadian food dietary guidelines and we see eat more fruits and vegetables or we see use less sodium, what does that actually mean? As Dr. St. John would have said, how do I know what is the daily amount of sodium that I'm supposed to intake? Can I link it to an actual tablespoon, which is something that I'm going to use when I'm preparing my meal at home? Because we need to emphasize that more persons need to make meals at home, even though we know, given the job, that more persons may be outside of the home. But to me, that is the linkage that we need to make more realistic in that we're showing the measurements that we use at home, linking it to the food label, and also linking it to our daily food guides for health. Thank you very much.
Yeah, yeah, and I think inherently that sounds like a good idea. In fact, when I heard it, it sounded like a great idea to me. Except that there's no evidence of its effectiveness, and that's why it's not part of the WHO best buy packages in the treatment of NCDs. You have this whole menu of packages for which you have various levels of evidence. The ones with the strongest evidence are called best buys, and calorie counting, sadly, is not a best buy. It's not even an intervention that has been shown to change behavior. It has been pushed a lot by industry as almost a kind of, well, at least this is allowing you to know how many calories you're consuming, and therefore you will consume less. But that isn't borne out in the evidence. And I think it is important in our discussion that we weigh evidence equally. The KMA study has been mentioned several times. It is not an independent study. It was funded, I think, by the private sector. And therefore, probably why I'm not too familiar with it, the details, is that it is not PubMed reference or in the scientific literature, which is kind of what we look for when we look at these kind of interventions and studies. You want a robust study that's studied independently. And as I agree with the panelists on the population of interest, or as close to that population as possible. But lots of us in the health sector, with all good intentions, we come up with interventions, which is what innovation is all about, which we hope will impact behavior. Calorie counting apps. I am a techie as well on my phone, and I really would have liked to see the evidence of that this intervention will work robustly, but there's none today. So until that changes, I'm not sure. It might be a good thing. I suppose it won't cause harm, but the question is really, will it cause good? The calorie counting app. Mm-hmm. Mm-hmm. By who? Okay. Right. Right. So let us be clear then, it wasn't an evidence-based intervention. It was a recommendation from government. So currently, though, there's no evidence for it. No, but you have posited an intervention and say, and I, with all respect for the Prime Minister, you've referenced the Prime Minister saying it is her recommendation. But let us not then compare, say, front of package warning labels to calorie counting, because the level of evidence is different. Right. Mm-hmm. Absolutely. Right. Mm-hmm. Right. Mm-hmm. Okay. So I think that is important. And of course, that data should contribute to the general body of knowledge that makes these recommendations in a statement like, say, the WHO best buys, because this is something that we would need to see evidence not just from our local circumstance, but obviously in other countries. Yeah. Right. Mm-hmm. Right. Yeah. Yeah. Mm-hmm. Yeah. It, mhm, mhm. Right.
Hi, good morning, all. Brian Payne, National Nutrition Center. What I will say is that there's studies and then there's studies. It's very difficult to make a comparison between a peer review study to a study which may have been possibly
Absolutely.
sanctioned or funded by a group or any group, published in a peer review article or journal.
It's who did the peer review of the because it's important that we are all speaking the same language. As scientists, when we say peer review, we require independent peer review by other scientists. So who was it peer reviewed by? Right. Yes. Right. And this is the point I'm trying to make. You cannot compare apples and oranges. It doesn't say the study is not credible, but it just says it's not to the same standard.
It's not a so again, there's studies and then there's studies, of course. But I think the comment I want to make as it relates to front of package warning labels, I think the idea that the high-end warning labels, the Chilean model, does not facilitate innovation is inaccurate. I think manufacturers have time or they have the technical know-how to actually reduce the nutrients of concern, which are primarily sugar, added fats, and sodium, they can reduce their products in those specific nutrients to actually not have the high-end warning labels. So I think to really highlight or to say that it does not facilitate innovation, I think that is another issue that I had. Thank you, Fabian.
Absolutely. Absolutely. Yeah. Yeah, I think this is the one point. No, we have agreed on several points, but I certainly do agree. Standardization is so important. It's confusing to everyone if you're using different standards in different spaces. I find it confusing purchasing in the US and then maybe doing a trip over to Europe and using another model in the UK. I mean, it is confusing, let alone having it in the same space. So the model, whatever model is decided on, needs to be as much as possible, evidence-based, standardized, and consistent across packaging. So that would be my final comment. Yes. It's not just her. Thank you very much.
Recording stopped.